Hello, everyone. My name is Safa Al Hassan. I'm here to share with you our auditing of maternal mortality done in Eastern Sudan. Our goal is to go about background, definition, analysis, and recommendation. Why is essential? Because they are young mothers, and we need to know what the cause, as we don't have any data for maternal mortality, and to investigate and to plan. Background, as in Sudan, we have scarce data on maternal mortality, and it is high because we have malpractice of female genital mutilation, and the aim is to reduce it. This is our maternal mortality in Sudan. There is high rate of female genital mutilation, low uptake of family planning and antenatal care, and widespread of literacy and poverty. We have a lot of challenges, include rainy seasons, and a lot of those maternal mortality could be prevented if something done differently. We have low number of caregiver in correspond to maternal, and this is the definition according to defined as a death within of termination of pregnancy, irrespective of duration and site of pregnancy. Sudan, Elgadarif state, and this is one lesson to be learned. It is avoidable, and with collaboration and use of resources, we can improve, and other policy can be. So this is the maternal mortality rate in this study, and this is the objective. We count every maternal, and that as a prospective study based on the community and hospital, and usually the focal person notify, and then investigation for that one. And this is a study design area Elgadarif, which is the biggest area for producing economy to the Sudan. The study population, we count all maternal deaths, and this is a variable, age and others, and data collected by the principal investigator, and this is part of multinational, which is done all over the Sudan. So this is a lesson. They are preventable, avoidable, and there are several factors can play a role. And this is a result which is not different from the globally. So we have the hemorrhage is the leading cause, and we have patients who died at home or brought in a critical condition. They are the majority, and hemorrhage is a leading cause. Eclampsia, sepsis, and anemia and other medical condition play a role. And this is from the according to the other resources. So the route of admission, they came from home, and majority of them, they are multiple patients, and there is no antenatal care in most of them, no antenatal care, and they are critically ill. The delay mainly is at home, and there is strong relation between uptake and delay of those lady, because their education not to the standards that led them to seek a decision at a suitable time. So poor antenatal care is a cornerstone. In conclusion, maternal mortality reflects the health system of the country, and this is our maternal mortality in Elgadarif state in Sudan. More effort need to be done to reduce maternal mortality. What should be done? Obstetric care is the cornerstone, auditing, notification, and increase the uptake of family planning, collaboration with stakeholder and community. That is, and this is the initiative that I led in Elgadarif state, and I have the opportunity to visit the rural hospital as a visiting consultant. So this is stating a different hospital that. And what we learn, education transform people's life. And this is the recommendation that we come up with. So free access to all emergency care, particularly obstetric, implementation and auditing hospital to improve the quality of maternal care and promotion of family planning service, raising health awareness, and provision of health services in remote area, and linking them to the center and strengthening the established referral system, rehabilitation of hospital, and increase the number of healthcare provider in corresponding to women seeking this, and rehabilitation of blood bank, because a lot of ladies have been lost as there is no any other blood bank services. So this is my reference, and I will expand acknowledgement to all who participated in this research, community midwife and their major role, family who lost their loved one and allow us to interview them, and Prof. Taha Mbelli, who is the national leader of auditing maternal mortality. And from this point of view, I would like to thank all who participated in this study. And I came up to learn that education is the best way we can able to change people life, and through that we expand to do the education through media, mainly the radio, as people listen frequently. And in addition to that, the use of lecture. Other than that, we have to improve other service, mainly the healthcare and antenatal obstetric unit in our area. Through that, we can achieve to reducing maternal mortality and to decrease the perinatal mortality rate. Thank you.